Hi, Diana. It's not quite 2, so I'm going to give folks a few minutes to jump on. Hi, Diana. And apparently, I didn't have my volume turned off on my computer. So, hi, Jan. Jan, I just had Jan Labonde send you another email, or I sent her an email to send you. We're going to talk about it today. I think it'll help you. I think it's kind of what you're looking for reopening. Well, usually these days are bright and sunny and beautiful outside, but it's gray and yucky out today, so we are stuck inside. We'll give folks a few more minutes. It always takes a minute to let everyone know that we're live. Everybody staying healthy, hopefully, and ready to reopen Kentucky and get back to work. Oh, you're welcome, Jan. Happy to. It's actually just came out yesterday evening, and I think it's a great resource for a lot of businesses that are reopening. So we'll talk about that. Well, I'm going to go ahead and get started. It's right at the top of the hour, and actually it's a couple minutes past, and folks can always catch the replay. So for those of you that don't know me, and I think Diana and Jan both know me, I don't think there's anybody else on here. I am Deanna Sizemore, Director of Compliance with Bim Group, and we've started these Tuesday talks to be an open forum to ask questions and bring you the latest, greatest compliance news that's coming out of Washington and wherever else we get regs from. So, Department of Labor, Internal Revenue Service, Health and Human Services, Centers for Medicaid, Medicare. But as luck would have it, we received some new guidance last week from the Department of Labor, issued in conjunction with the Department of Treasury and the Department, the IRS, about extending deadlines for certain ERISA requirements. Now, before I go into these requirements, I'm going to preface this and say, and this is what I told our team, this is not a get out of jail free card. You as a plan administrator, plan sponsor, still have to do these things. It's just if you miss the deadline or the timing of it, it's not going to come back against you. The DOL is offering relief for certain ERISA requirements during the time of a pandemic. And fortunately, part of the EBSA Disaster Relief 2020-01 regulation, it extends the time for plan officials to furnish benefit statements, annual funding notices, and other notices and disclosures required by ERISA, as long as a good faith effort is made to furnish those documents as soon as administratively possible. I'm going to talk about what those requirements and those changes are as it applies to a health and welfare plan. There are some changes related to a retirement plan. If you want to look into those pieces of information, you may want to check with your retirement plan provider, or you can go to the IRS site, or you can search EBSA Disaster Relief Notice 2020-01. So the relief is effective March 1st of this year, and it ends 60 days after the announcement of the end of the national emergency. So, for example, if President Trump were to end the national emergency for COVID on May 31st, 60 days post May 31st is when this relief ends. The relief allows employers more time to provide a copy of a summary annual report, a summary plan description, a summary of material modifications. Those reports are typically due 60 days after filing. With this relief, you have 60 days until after the end of the national emergency is declared. So, the good faith effort means by using alternative means. So in the past, any type of forms like that have to be provided via paper unless you have folks who are working at a computer with an email as an integral part of their workday. You could email them. With this new relief, they're saying a good faith effort could be a personal email, it could be a text message, any means possible to get the information in the hands of the employee and participants. So just be aware that they also say continuous access websites, so an intranet that your team has access to while not at work. Not only does it apply to the distribution of summary annual reports and summary plan descriptions and summary material modifications, it also applies to COBRA, and it has a big change to COBRA. As you know, with COBRA, there is a election period of 44 days, or 44 days to get the notice out, an election period of 60 days, and then another 45 days to make the first premium payment. All of those deadlines are gone during this time. Again, good faith effort to meet them, so you don't want to not send a COBRA notice. But if you send a COBRA notice out timely and someone does not return that COBRA election form to you until 35 days after the end of the national emergency, they're still eligible for COBRA. Now, they're still going to owe back premium, but just know that this EBSA Notice 2020-01 has given employers relief, and now we're seeing it's given participants relief or beneficiaries. So you have extra time. If maybe maybe the addresses are at the office and you can't access those. Maybe the address is in an email somewhere that you can't find, but you can email it to them because they've got company email. So just be aware of that. We actually talk to our account managers and account executives about this. If you got any questions, you can reach out to them, or you can also reach out to me. So here's an example with that extension. Assuming a COBRA notice has been provided, an employee would have until 120 days after the national emergency to elect COBRA. So that's the 60-day window. National emergency ends. It's not effective for 60 days after that. And then they get another 60 days to elect on top of that. And then another 45 to pay the premium. So again, they can do it. It can be in arrears, but they're going to owe all that back premium. There's also the extension of deadline for adverse selection or adverse determination of claims, for a claimant to file an external review of a claim that was possibly denied, for individuals to notify you of a qualifying event. So someone has a baby, someone has a spouse, and they come to you anytime during the national pandemic, even if it's more than 30 days, you need to allow that dependent to be added or dropped or whatever that change may be. And then once the national pandemic ends, add your 60 days, they still have another 30 to come to you and say, I need to add this person, drop this person, etc. So just be aware of those changes. Again, it's not a get out of jail free pass. It's not a, you don't have to do anything. You still have to do it. It's just you're given some grace. I thought that was important to go ahead and start this. I know we talked last week about reopening business and what that's going to look like going forward. And I started going through a rather lengthy overview of things that you can do from a national level that I had been following. And we covered that, and we'll continue to cover that. But what came out yesterday was guidelines from the state of Kentucky through the governor's office. And I felt that was imperative to cover today. If you see the link in the chat, it's govstatus.ky-healthy-at-work. That link, which we will also post on our website with the Tuesday Talk video, will take you to Kentucky's Business Restart page. There's some great information out there. I'm going to cover some of it at a high level. So while I'm going through this, if you've got questions, please feel free to pop them in the chat. I will answer them either as we go or at the end, whatever makes sense. But the governor came out yesterday, and we have a lot of businesses reopening on May 11th. He announced that we did have 163 new confirmed cases of COVID, and we've had 8 new deaths. So I think what I read earlier was that the curve is flattening, but it hasn't flattened. So even though we still have new cases and new additional deaths, it's not jumping and spiking like they had thought it would had we not taken protective measures. So the first wave of openings is restricted to businesses without a lot of face-to-face contact. That includes manufacturing, construction, automobile and boat dealerships, office-based businesses, racetracks without fans, photography, pet care, and grooming. Now, the photography one, when we get there, you'll understand. I was like, okay, how's that going to work? However, with that being said, Governor Beshear's office released 10 rules that all these businesses must follow. It includes wearing face masks, providing hand sanitizer, conducting on-site temperature and health checks, referring ill employees for testing. He did say that they have procured 20,000 3-ply masks for businesses through the Kentucky Chamber of Commerce. And you can access those masks for $1 each by going to the kentuckychamber.com/mask order form. And again, that's kychamber.com/mask order form. The Kentucky Distillers Association has agreed to sell hand sanitizer to Kentucky businesses. That is kyhandsanitizer.com. Does not have a price on there, but again, the masks are available at $1 each. I know for my husband's business that he owns, we ordered masks from Amazon, which you have not been able to get until this past week. And I think we're paying a little over $1 a piece for the ones that we got. So that's a good deal if we can get a hold of those. So for non-essential manufacturers returning to operations, the guidelines require staggered work shifts, breaks to avoid people coming in at the same time, and where people can't stand 6 feet apart, there should be physical barriers put in place. Employees have to wipe down their own workstation with disinfectant when they're done, and businesses have to do away with time clocks that everyone touches. So again, you're limiting the amount of people that can interact, and you're disinfecting everything that they touch and limiting the number of times and ways that people touch things. On construction sites, the regulations say all employees must wear face masks, and they encourage businesses to phase in employees. There are specific guideline PDFs for each of these industries that you can pull from this website. So automobile and boat dealerships are allowed to only have 25% capacity in their showrooms. And the guidelines say that all paperwork should be completed electronically. Businesses should communicate with customers over the phone when possible. Customers must be allowed to test drive vehicles without an employee present in order to maintain social distancing. Again, new way of doing business, thinking about, how you're operating. If you're an auto dealer, these are things you're going to have to do. There's also some reopening points directly for automobile dealers and boat dealerships. And Jan, that is what I asked Jan Labonde to send to you. Office-based businesses. So this is an office space where there's not a lot of face-to-face customer contact. Can reopen with 50% capacity. Employees have to wear a mask unless they're in a personal office or if it will risk their health and safety. The guidelines encourage online documentation rather than paper documents and suggest meetings be conducted over the phone. Racetracks can open, but only to authorized employees. There's no fans, no press, no guests or family members out on the track. If you're supporting a horse that's stabled at the track, you have to stay in the barn or the tack house unless you're going to or from the track. Oh, you're welcome, Jan. Guidelines for pet care, grooming, and boarding. I don't think we have any clients in that space, but if you're like me and you have your own fur babies, this might be good to know. The owner must take the collar and leash off the pet and put the pet either in a crate, curbside, or into an entry room. Workers should not have any contact with customers. Payment must be done over the phone or internet. I know my dog groomer is meeting people at the door and opening the door and letting you put the dog in. Governor Beshear added another category to reopen, and it's photography. So photographers can reopen as long as they're taking family unit photos. If there's photos of people, this is the part that I thought was kind of comical because I'm like, how does this work? If the photos of people are being taken and those people do not live in the same household, they have to stay 6 feet apart. All photography should be done outside unless an in-studio session is essential. I don't know who determines if that's essential, unless it's maybe like a day today where it's rainy. I don't know. And then we've got the next phase of healthcare reopening on next Wednesday, the 11th. This is outpatient procedures, colonoscopies, eye surgeries, heart stents, etc. Chiropractors and dentists are already open in limited capacities. So the other piece is they added that there's 17 drive-through testing sites open in Kentucky. There's a new partnership with St. Elizabeth in Northern Kentucky that's going to be offering testing at Kenton and Boone counties. I know we've got several locations here in Lexington. So, lots of things to think about and do as we open a new business. One of the things that I did pull from this Healthy at Work website was the minimum requirement for all businesses. So the idea is to really reopen, but limit that contact. And it's, telework when possible, phased in return to work. You don't want to bring everybody back at once. You want to bring back people in stages. You want to be generous when it comes to telework, sick leave, family leave policies for those who can't come to work either due to illness or childcare, taking care of family. You really need to enforce social distancing, ensure that individuals do not have contact that's less than 6 feet. You want to keep employees and customers separated as much as possible. Limit face-to-face interaction. Again, telephone, webinar, or WebEx, Zoom, however that may be. And provide universal employee masks. And again, we talked about the mask from the Kentucky Chamber. You want to make sure folks have access to those without any additional costs to them. You want to have a testing plan in place. So if you do have any employees that pop up as becoming ill with COVID, how are you isolating that individual? How are you isolating the individuals they've interacted with? You've got to be able to notify the health department and provide the employees information along with the information of the employees with who they've had contact with. And again, this is where HIPAA comes into play. HIPAA has a clause in it that if it's a national emergency, you can share that pertinent data with public health services. So if you were to have an employee test positive, the employees that were in contact with that employee, you can say, we've had an employee test positive, you were in contact with them. You're not supposed to give them their name. However, you call the public health department to tell them, you give them their name, what happened, and the names of all those in contact with them. So again, just that fine line of making sure you're doing what the law and regulations allow, but also being compliant with national pandemic strategy. I thought this was interesting. You have to make special accommodations for those who are in high risk categories. So if you have someone who's at a higher risk of a severe illness, maybe they have a suppressed immune system, or maybe they have a heart condition or lung condition, make special accommodations for them. You also have to have a healthy at work officer. So you have to ensure that there is an employee who is designated as a healthy at work officer, and that person is responsible for the business compliance with guidelines and other guidance provided. And businesses should allow for employees to identify and communicate potential improvements or suggestions to that healthy at work designated officer. Obviously, educate and train employees. Training must be offered during scheduled hours with no cost to the employee. And that training is regarding healthy at workplace protocols, whether that's your temperature taking and health checks and sanitizing your workstation and no more than, 2 people in the break room at a time. Those kind of things. You want to ensure that you are training and educating your staff so that they understand what's required of them. And then contact tracing. This is probably the hardest thing for a larger company, and maybe I'm thinking a manufacturing company or an automobile dealer where maybe your service department's open and you've got sales and service interacting. You need to be able to understand who that employee has contacts with at any time during the day. Smaller offices, that's easier. If I think of, Bim Group, if we were in the office, my corner of the office, there's 3 people that I'm in contact with most often. Everybody else, I don't see that often because I'm in my office working. But if I'm at a manufacturing floor and I'm going between departments, I might touch 50 people. So you need to be able to track that. Again, this is the all businesses guidelines. They also said that you should encourage customers to wear a mask. You should provide access to gloves, especially if there's a job duty where employees have to touch things often, credit cards, paper, computers, machinery. Wear gloves that are regularly replaced. What we're seeing now on gloves and face masks is the cross-contamination. In that educating and training employees, you need to educate and train employees on how to properly remove a mask, properly remove their gloves, so that when they take those off, they're not either contaminating themselves or they're cross-contaminating other things. I was reading an article that was talking about if you put on a pair of gloves and you drive in your car and you go to Kroger and you go all through Kroger and you come out and you're still driving your car with the same gloves on, and then you go to Walgreens and you go in there to pick up a prescription, but while you're in there, you look at whatever's in the Easter clearance aisle. I was trying to think of a holiday that's close by, and you're touching that stuff, and then you get back in your car, and then you drive to pick up your child from the babysitter, and you go in their house, and you take your gloves off in there and throw them away. Everything you've picked up along the way is on those gloves, and those gloves are now in another person's house who hasn't gone to all those places. So you should be replacing your gloves often. You should replace them every time you leave a store and before you get in your car. And the other thing was said, it's sometimes better to not even wear gloves, to just after every store wash or use hand sanitizer on your hands. So those are things you need to educate on. Mask, people want to take them off, grab a hold of it here, take it from the other side. Well, you've just put everything that's on the mask on your hand. So there's a proper way to do that as well. Those are things that you're going to want to make sure your employees understand. With that, you should have adequate hand sanitizer available and encourage hand washing. You should disinfect high touch areas, light switches, the copier, a workstation, a community workstation, a telephone that maybe it's in the center office that everybody can use. You need to absolutely encourage that hand sanitizer and then the routine hand washing, and just be consistent with that. You want to restrict common areas, the waiting room, the break room, conference rooms, lunch rooms, because you need to maximize areas for social distancing, but at the same time reduce congregating, because you don't want 15 people coming into a 20 by 20 foot room to have lunch, and everybody's, sitting there talking. So again, it's keeping that things to a minimum. Proper sanitation, I just kind of talked about that. Credit card machines, doorknobs, any area that it's going to be high touch, you're going to need to have sanitized. I will tell you again, from a sanitation perspective, Lysol wipes, Clorox wipes are nowhere to be found unless you have a stockpile. Sam's Club makes it's a commercial sanitizer. You can get a gallon of it for $15. It can be diluted, and it is EPA approved to take care of 99.99% of germs, even those related to COVID. You just have to double the strength of it's a concentrated mix, 2.5 ounces to a spray bottle versus one. I think it calls for 1 ounce to dilute it, but if you double that, it is good for reducing COVID. Again, my husband's company, he uses it everywhere he goes. It's great for disinfecting things when you can't get your hands on Clorox or Lysol wipes, which seem to be non-existent these days. And paper towels. We're now having a paper towel struggle. So, we mentioned this earlier, the conducting of the health checks and daily temperature. You have to require employees to undergo daily temperature and health checks. The checks can be done at home. They can be done self-administered. They can be done at the business prior to entering the business. Self-administered temperature and health checks should be or can be performed at home. Sick employees should be directed to a healthcare provider for testing. And this also includes employees who maybe they passed the temperature and health check, but now they're not feeling well. Send them to a doctor for testing. Create the testing plan. We kind of talked about that. We talked about the special accommodations. So this is some of the same stuff for all businesses that applies to the business location. So again, Healthy at Work is a great resource if you're in Kentucky. If you're not in Kentucky, I'm assuming there's some for other states on that govstatus.egov.com site as well. There's just, it's a new normal for us. And even though we're slowly opening back up and we're in phase 1, it's still going to be a while before we're at full capacity. So with that, I've been talking now for about a half hour. I'm going to pause and see if anybody has any questions. Because what I don't want to do is miss that. I know you guys jump on here. We're absolutely available for questions. If you think of something later when the broadcast ends, feel free to email me directly at deanna@bimgroup.com, .us, or info@bimgroup.us. Let me see if I can put this on here. Give anybody time to ask any question that they may have. And then next week we'll talk more about returning to work. What I do want to try to do is I'm working with a local HR consulting company to see if they would be interested in doing a joint broadcast and talking a little bit from an HR perspective. I can speak from the benefits perspective all day long, so but not necessarily the HR perspective. So my email address is in the chat. It's deanna@bimgroup.us if you think of something later that you want to ask. But in the interim, is there any questions? Let me see if I can put this Kentucky Chamber piece on here as well. So it's KY Chamber. Well, autocorrect has changed it up on me. And again, these masks through the chamber are $1 each. I don't know how long they will last. They received 20,000 of them. I don't know if that's the number we're going to need, or if they're going to have to get more, or what that's going to look like. So there's the Kentucky Chamber mask order form. And then we have our Kentucky hand sanitizer. If I can spell. And again, there was not a price listed on this, but spell it right, yeah. Anybody have any questions? Well, as a reminder, all of our Tuesday Talk videos are available on bimgroup.us. I believe if you go under the COVID-19 page, which you can find at the top, scroll all the way to the bottom, you'll see Tuesday Talks. There will be today's video as well as all the prior videos. FAQs from each of the sessions is listed. The FAQs for the past 2 sessions are not on there yet, and that is my fault. So I'll get those done as quickly as I can, and we'll have this session uploaded as quickly as we can as well. So I am going to give it just another minute or two, because I always say, hey, let's call for questions, and then I close it, and then I see a question. So or if there's something, let me also say this, if there's something that you would like to talk about on one of these conversations on our weekly chats, please let me know. You can email me that as well. Right now it's kind of been all things COVID and return to work and any current regs is coming out, but I'd be happy to address any other topics. So, okay. Well, with that, my friends, I'm going to say goodbye for this week. I will see you next Tuesday at the same time. Stay safe, stay healthy. Remember to social distance. And I hope you all have a wonderful afternoon. Again, if you need anything, please don't hesitate to email me. Thanks.